The numbers of active cases of COVID infection in Victoria have more than doubled in the last 7 days. And now it's the vulnerable in cramped conditions who are at risk. A situation which can spin away from the authorities all too quickly.
Overcrowding conditions act as a pressure cooker for this virus. It takes every opportunity and goes from a reproductive number of 2.5 to multiples of that.
Until April, Singapore was the poster child for COVID-19 control. The tiny island nation basked in international praise. Then their case numbers exploded, with over 1,000 new infections a day, largely among migrant workers in crowded dormitories.
In the community at large, things were going well. We had good levels of testing, we had contact tracing, everything was in place and things were humming along quite well. But then we had this sort of massive super spreader event, if you like, where it entered this high density population in the dormitories, and then it became very challenging to control with conventional outbreak response.
Like Melbourne, Singapore placed whole buildings housing thousands into isolation.
Once you start to do that, you have to make things good for them on the inside, if you like. You have to give them information, you have to do all the logistics, make sure they've got food, make sure they've got Wi-Fi, and most importantly, make sure they've got information so that they know how long this might last for, they know what they can do, how do we empower the people that are locked in to help themselves to make this over as quickly as possible.
So the most effective method of preventing spread is sadly to remove an infected person to a purpose-built facility.
The other action Singapore took was to escalate the lockdown of the whole country, not just the dormitory areas.
At that time we were having 70 cases a day. There were quite a few unlinked cases, and we just thought it was time, rather than waiting till it got to 100, 300, 500, when it gets much more difficult to control.
But in Melbourne, only residents in tower blocks are isolated. Authorities have locked down other suburbs, a strategy known as ring fencing. But residents in those areas have much more freedom than is usual with this strategy.
They have a very strange version of ring fencing, where you can go to study or go to work, which is not a classic version of ring fencing that has been used very effectively in Wuhan and other places, where people are within their homes. They can go exercising as long as they've got masks on, but they can't go to work, and particularly without a mask on, because then they will spread it even further.
The question that needs to be answered is whether this outbreak is now beyond the capacity of Victoria to control.
If I were the authorities attempting to control this, I'd be terrified, because what they're seeing now has occurred 5 to 10 days ago. And so they're always 5 to 10 days behind exactly what has happened. And this could have escaped even further.
If I was in Melbourne now, as my sister, daughter and 90-year-old mother are, I've told them not to be too scared, actually. I'm watching the Victorian response. I think there's a lot of good features to it, and frankly, if other states in Australia aren't doing this type of scenario, what if this happens in our city, how are we going to respond, then I think they're making a mistake, because this can happen anywhere. You've just got to find your weak spot. If you don't find it, the virus will.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.